Do you need help with your HESI exam? These are just some of the questions you will encounter for HESI exams. 1. A client reports pain, numbness, and tingling sensations in the lower legs. How should the nurse document this finding? A. Acute pain. B. Neuropathic pain. C. Visceral pain. D. Nociceptive pain. 2. The healthcare provider prescribes ear drops to an adult client with an ear infection. Which teaching should the nurse provide? A. Pull the pinny up and back to administer the drops. B. Administer the drops with the head held upright. C. Cool and shake bottle before administering the drops. D. Insert the tip of the dropper into the canal of the ear. 3. The nurse is using guided imagery with a client who is experiencing chronic pain. The nurse should direct the client's attention of which focus? A. Motivational phrases. B. Emotional reflection. C. Positive external places. D. Tranquil sounds. A client who is on complete bed rest frequently call the nurse for the bedpan to urinate. Which action should the nurse take to evaluate the client for urinary retention? A. Palpate the suprapubic region of distension. B. Review the chart for number of voids over the last 24 hours. C. Evaluate the client for urinary incontinence. D. Skin the client's bladder after voiding. 5. While teaching a client how to perform a skill, the nurse determines that the client is experiencing sensory overload and is unable to learn effectively. Which action should the nurse implement? A. Provide the client with step-by-step written instructions. B. Demonstrate the skill, speaking slowly and using simple terms. C. Reduce the stimuli in the area before continuing the teaching. D. Reassure the client that the skill is not difficult to learn. 6. The nurse observes an unlicensed assistive personnel, UAP, who is performing hand hygiene before entering a client's room, as seen in the video. Which action should the nurse implement? A. Advise the UAP that a full minute is needed for thorough cleansing. B. Demonstrate the correct technique for effective hand hygiene. C. Explain the purpose of wetting hands when beginning hand care. D. Remind the UAP to apply gloves upon entering the client's room. 7. After a week of bed rest. A client is being assisted to a chair for the 5th time. The nurse raises the head of the bed and moves the client to a sitting position. What action should the nurse perform next? A. Place the chair by the bed. B. Offer a pair of non-skid socks. C. Determine how the client feels. D. Support the client when rising. We help ESL students with their online classes and exams. If you need help, email us at support@eritajigs.com.